Welcome to Kiran Infertility Center. Today's question and answer sessions is about creating awareness to the people regarding infertility and new IVF techniques. On our esteemed panel, we have three eminent gynecologists today. I take the pleasure in introducing stalwarts in infertility for about last 3 decades, Dr. Kiran D Sekhar ma'am, who is Chief Consultant at Kiran Infertility Center and IVF, and Dr. Pratima Sekhar ma'am, who is Senior Consultant at KIC and IVF. Dr. Channa Reddy ma'am, who is an obstetrician and gynecologist at Sri Hospitals and who has a keen interest in the field of infertility. I would like to ask my first question to Dr. Kiran ma'am. Ma'am, can you please brief up and introduce regarding our Kiran Infertility Center?
Yeah, I'll be very happy to, Chetna. Actually, our Kiran Infertility Center was started in the year formally inaugurated on 28th of December 1998 at my old facility, which was situated in Abbott's area, in the one of the areas where actually it was a central area of Hyderabad, and then we thought, why not we start it here? And it was inaugurated by none other than the stalwarts in the field of IVF, infertility and gynecology, Dr. Sonawala and Dr. C.S. Don, and it was a very grand affair at that time because we were the third facility in Hyderabad, in whole of Andhra Pradesh, not only in Hyderabad but whole of Andhra Pradesh. So we are very proud to actually tell all our viewers about that. And my keen interest in infertility started when I was an assistant professor and associate professor at Government Maternity Hospital, where I was in charge of infertility services. Of course, those days infertility services were very limited. We used to have only, history taking, giving some tablets to the patient, doing the tube testing, very, very preliminary. But I think those days the fertility rates were good. That's what I would ask afterwards for your comments also, the other two doctors on the panel. Those days, little bit of a treatment also used to help the patient.
Stress, how about you?
Yeah. So those days, little bit of a treatment also, talking to the doctor, few kind words from our side, little bit of a, tapping on her shoulder and saying, we will definitely conceive, nothing much is wrong. And doing simple procedures like DNC, that is the cleaning of the uterus, and doing the test tube, not the test tube, but the tube testing of the patient. So that used to give us very good results. But the science has taken leaps and bounds from that time. 1978, actually, the day I passed my MD, that month only, July 1978, the first test tube baby of the world was born. Her name is Louis Brown, and she was conceived at the London center, Bourne Hall Center. And from there, the science and the technology actually grew very, very fast. So that that interest actually I took, and I started the IVF center and then with the grace of God, and with the help of all the friends, everybody, and in the community, and my patients, to whom I'm very indebted. They are the ones actually who are actually my backbone. And then we enlarged the facility, came to the present facility of our newly constructed hospital at Hyderabad, and from there the whole events took up.
Ma'am, as we just know about, came to know about your idea, inception of the Kiran Infertility Center, what was the main motto behind it, ma'am? What was the force which was driving you towards infertility? Because then it was a very rare scenario. Then what was the main thing which drove you for this, ma'am?
Yeah, it was one of the subspecialties of our branch, like OB-GYN. The subspecialty was infertility, because in the foreign countries and in the West, it was taking up in a very big way, all over the United Kingdom, America, Australia, and Singapore. These were the 4 centers, which were doing very good work in the field of infertility. They were the one who were the pioneers, and then it was started in Mumbai, Hyderabad, and other cities of India. So my motto there was, to offer cost-effective services to all our patients and our clientele, because I remember still people going for IVF to, abroad about 40 years back. Like nobody was offering the services here in India. So they were going abroad also and conceiving a baby and coming back. So then all our doctors at the Federation of Obstetrics and Gynecological Societies of India also felt that why not, we offer the services here only, and slowly we got trained in that field. Slowly we went abroad also and got some more training. And once the center was started, it was by trial and error, I would say, and also I would say by, like our continuous zeal of working in that field and having, organizing seminars, international conferences. All this also helped us. I will be actually showing some pictures also to you wherein, we have at years back the conferences we conducted and the response we had. And from there, my motto was to offer services. It was a service oriented project only, and still it is one like that only. So, to offer services which are world class in nature to our own people in country and to cater to their needs.
I just wanted to know what have been the advances in the field of IVF since then, since it's almost 30 years, 3 decades down the line. So, what are the most advances what you have noticed?
Yeah, I would divide the advances into, female factor advances and male factor advances. The female factor advances have been, like we have very good state of art drugs and injections now available, gonadotropins available, which were not available 30 years back when I started the center. Now we have gonadotropins which are prepared by the DNA, and the recombinant technology. So they are very effective, and cost-wise also the cost has come down, and they don't have much side effects also, so the patient easily tolerates them. So that is one of our very big plus points in the female infertility. The other female infertility advances have been uh, in the field of egg pickup, where we have state of art needles now and very good apparatus to actually take out the eggs from the ovary, egg retrieval and all that. So that is one more technology which has come up. Then the embryo freezing technology also is a very important technology. Some later date we can talk about it in detail also. But I would just like to touch on that and say that embryo freezing has made our life very easy. And the days of, those days where the pregnancy rates were only 20-25% when we started with this technique, now these rates have increased to about 70 to 80% in the frozen cycle. So all over India and all over the world. So that has been in the female field. And in the male technology field, we have actually the micro manipulation of the gametes, wherein we inject every single sperm into a single egg like that. So that has actually revolutionized the whole approach to male infertility. So azoospermia, that means where we do not have any sperms in the patient's semen analysis, still we can get the sperms from the testis or from the epididymis of the patient, and we can do the technique. So that has been another advance, and that has actually revolutionized our whole treatment strategies.
I am just more curious now to know about, in which of the other cities you have expanded yourself, where can we have these facilities available, other centers of the Kiran Infertility?
Yeah. To answer your question, actually, we extended our facility. The first one to expand was in Bangalore, which is the capital of Karnataka. And then there also we have got a very good state of art center, which is managed by very well trained and very well, acclaimed gynecologists there locally from Karnataka and Bangalore. So that center also is doing well in catering to the patients in that area. Then we felt that there is a need in Chennai also. So about 6 years back, we set up a center in Chennai also. That is also doing pretty well. And I actually helped establish centers, those doctors who were interested. They were gynecologists, but they had keen interest in infertility, like Dr. Shamala here and other junior doctors who come and meet me, usually. So for them, we started one in Khammam, and one more center was established in, Karimnagar. So those centers are also doing well and now have come up to higher levels of grade level 3 and level 4, or level 2 and level 3 also. So that is the advances there, and we actually extended our facilities abroad also. So we were catering to the needs of patients in Dubai, and our other centers of infertility and surrogacy were established in Ukraine and Colombia also. So like that we have expanded our reach to patients all over, trying to reach all patients all over the place.
Thank you, ma'am. It was really nice talking to you, and it's nice, ma'am, to listen about all these things. Thank you.